Hi, my name is Ben, and I want to talk to you about the Cancer Drug Challenge. But first, I want to talk to you just a little bit about cells. Now in your body, you have trillions and trillions of cells that make up each and every single part of your body. And you have lots of different types of them, like brain cells, skin cells, and blood cells, and many different other kinds. Now each and every one of those cells has a very special and important function that helps keep you alive. Like all living things, cells grow and reproduce. They make more of themselves. But sometimes cells grow out of control, just like weeds in a garden. And this is really bad for your body, and it's a disease that we call cancer. Now every year, thousands of people die from cancer, and millions more find out that they have it. But there are a lot of effective cancer treatments out there. One of the most common treatment methods is called chemotherapy. Now chemotherapy works by taking special drugs and giving them to a patient. And those chemotherapy drugs works their way into cancer cells and stop them from growing out of control and prevents them from making more of each other, which is exactly what we want to try to do today. We want to try to get our special cancer drugs into our cancer cells. But first, let me show you our test setup. The first thing we need to do is get a large fan into place so that it's blowing upwards. Make sure that the fan is off the ground so that the fan blades can pull air upwards. The next thing we need to do is put our cardboard box on top of our fan. Make sure that you tape all of the bottom flaps together so they don't blow out while the fan is on. We also need to tape together the top flaps, all of them except for one, which we want to leave loose. Now you can add our cancer drug to the box. This is like injecting the cancer drugs into a patient's body. Now let's take a look at our cancer cell. This cancerous cell is about to start growing out of control, but doctors caught it before it made the patient too sick. And so we can try and treat this cancer by trying to put the cancer drugs into the cancer cell. In order to test the effectiveness of our cancer drug on our cancer cell, we need to tape our cancer cell to the bottom of our test setup, and then turn on our test setup for 30 seconds. When our test is over, we can take out our cancer cell and see how much of the drug got inside. When setting up your box, it's important to remember two things. One, make sure that your box is smaller than the diameter of your fan blades. Because if you use a box that's too big, then the cancer drug gets stuck to the sides of the box where the airflow is low. And two, you can use the loose flap at the top of the box to control how high the cancer drugs will fly. Once you find a good maximum height for your cancer drugs to be flying, make sure that you tape the loose flap down in place. Now it's your turn. You're going to use the engineering design process in order to try and improve this cancer therapy. There are 4 steps to the engineering design process. Step 1, identify. Why doesn't this cell uptake all of the cancer drugs? What is it about our situation that causes all of the drugs to not end up in our cell? Step 2, design. How can we modify this cell? How can we change it to improve the uptake of the drug? Make sure that you draw out all of your ideas beforehand. Step 3, build. Now that you have all your ideas, go ahead and choose the best one, whichever one you think would get the most amount of drugs, and build it out of the materials that you have. Step 4, test. With your modified cell, try it out in the test apparatus and see how well it works. However, you're not done yet. The engineering design process repeats itself. It goes in a circle. So once you've tested your modified cell, go ahead and take a look at it and identify some of the different ways that it worked and maybe some of the different ways that it didn't. And go ahead and think about and design some new ways to improve on that idea. Hopefully, you can engineer the best cell possible in order to get the most amount of cancer drugs into the cell to help effectively treat this disease.